to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many cultural, religious, and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences, and ask to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request health at CAHN.org.uk, we encourage you, community. CATHIP is funded by the National Lottery Community Fund.
Good evening, ladies and gentlemen, and thanks for taking time out to join us this evening for a special midweek version of CATHIP Health Hour. So that's the Caribbean African Targeted Health Improvement Program, and we're delighted this evening to have a special topic, but also we have other partners outside the normal CATHIP partners. So donor from the BHA for Equality, which is a charity that's been going for over 30 years based in Manchester, but they've done lots of work on prostate cancer. They are partners in this, as well as, you know, the doctor who is going to be presenting tonight. Tonight is going to be really interactive. We're going to be using Slido, but also we want you to tell us in the chat box where you're joining from, because it will be really good. And I'm sure Dr. Tolofari will talk a bit more, because this is part of a wider piece, you know, across the country. But clearly the focus is our community, the Caribbean African community, and it's a really important topic. We all know about the disparities, but I'm not going to steal the thunder. So once again, welcome everyone, and great to see you all. But for the CATHIP partners, we have Rafa, you know, based in Birmingham, Rafa Development Agency. We have Croydon BME Forum in London, the Enfield Caribbean Association in London Borough of Enfield as well, Black Health Initiative in Leeds, and then the RCCG Royal House in Sheffield. So, you know, these 5 partners, we've been, plus CAHN, we've been working, and we have the sessions usually on Saturday mornings, but this is a special one. And I'm hoping that, you know, you will find it interactive, informative, and go away empowered. But also, there's a special guest who will be talking about lived experience. We like to hear real stories. He's amazing, he's fantastic, he's raring to go. But I'm going to hand over to Dr. Sotonye Tolofari, who will introduce himself and then tell us what to expect. So over to you, Doc.
Thank you very much, Charles. So first of all, I'd just like to thank CAHN. So thank you for having me this evening, and thank you everyone in CAHN for putting on this event this evening as well. So as described, so my name is Sotonye or Sot Tolofari. I'm a consultant surgeon based in Manchester, and I want to talk to you today about prostate cancer and your potential risk of prostate cancer. So I'm going to speak for about 10 to 15 minutes or so. We're going to be joined by Gilly Morgan, who's one of our prostate cancer champions. He's a prostate cancer survivor, extremely passionate about this subject, and he's going to be talking to us as well about his story. So if you just bear with me, I'm just going to share my screen, and then we'll get into the talk. So just bear with me just a second. Okay, so hopefully you can all see that now. Okay, let me know if there's any issues with seeing that. Okay, so as I said, so I am a consultant urologist and a consultant surgeon. So what that means is that I specialize essentially in the treatment of anything in the urinary tract. So that can include, can everyone see my screen okay? Just checking. Yeah, okay, good. So that can include the treatment of anything from the kidneys to the bladder to the prostate and beyond. And my specialist interest really is in the treatment of kidney cancer and more relevant to this, prostate cancer as well. I've been a consultant for several years and I've trained within the region of Manchester and have been here for the last decade or so. Now, I've very recently taken over as chairman of all urology cancers, so all cancers including kidneys and prostates within the whole region of Greater Manchester. And with the help of people from CAHN and with the help from colleagues from the BHA, we've been creating a campaign to help raise awareness for Black men in our community and in the wider community about their risk of prostate cancer. Now, some of you may or may not know that if you are a Black man, you are at a higher risk of developing prostate cancer compared to a white man or an Asian man, for example. And not only that, you may be at risk of developing a slightly more aggressive form of prostate cancer, which may need treatment sooner rather than later. So our campaign is to get this message out there, to let these men know that they may be at risk of prostate cancer, and really get into a conversation with your doctor or your GP or whoever that is about potentially having a blood test or an examination, which may potentially save your life in many cases. So that's what we want to talk about today. We've been working on this campaign in the background now for the last 6 months or so, and we've been developing ways that we can look at speaking to GPs and getting the message out there. But what's really important today is I want to get your opinions and your ideas on whether you think this is a good idea, whether you think this is something that you'd be happy to be involved with, and whether this is something that you'd actually come along to or be engaged with. Now, Charles has very kindly asked who's coming from Manchester today, who's signed in from Manchester, and I can see in the chat a few of you have said you're from Manchester, which is good. We are running this this campaign across Manchester, but we're also looking at potentially extending it further if we get the funding to do so. So I'll get into the talk, and then we'll have some time for questions and answers a bit later, and we'll be hearing from Gilly about his story as well. So first of all, a little bit about me then. So this obviously isn't about me, but just a bit about my background and how I got into being a doctor and actually got into treating prostate cancer. So I was born in Leicestershire back in 1987, so I'm still only a young man, I think. I was born to a Nigerian father and a Jamaican mother. I studied medicine and graduated back in 2011. And as I said, I've become a consultant surgeon in the area treating kidney and prostate cancer. Now, this young man here is myself, age 15. And I've not just put this in here to embarrass myself, but the reason I put this picture in here is really to tell the story of why I think prostate cancer is important to me. So when I was around this age, when I was around 15, my grandfather, who was only in his 60s or 70s at the time, was diagnosed with prostate cancer. And unfortunately, this wasn't just prostate cancer that was within the prostate, it was prostate cancer that had spread. Now, my granddad was a typical Jamaican man. He wasn't really interested in seeing his GP or seeing his doctor. And he didn't really know much about his prostate cancer risk. And unfortunately, within about 12 months of being diagnosed with prostate cancer, he passed away. Now, I often think to myself, if he had known a little bit more about his prostate cancer risk, if he had known to seek advice, then he may have been able to seek treatment and he may still be with us now. So I think it's important that we're aware of our prostate cancer risk. And I'm very keen, and it's very high on my agenda, to make sure there's no inequality when we're treating patients within Manchester and throughout the UK. I think if you're a Black man, you're at risk of prostate cancer, and I think it's important that you're given that opportunity to seek advice where appropriate. So just a little bit of background then. So we know that prostate cancer is the commonest form of cancer in men, not just in the UK, but actually in the world. We know that there's hundreds of thousands of men diagnosed with prostate cancer each year within the UK. And we know that it happens more commonly the older you get. So if you're in your 40s, the risk of getting prostate cancer is low, but the older you get, the higher the risk becomes. And we actually know that 80% of men over the age of 80 will have prostate cancer. In some cases, prostate cancer may be something that you live with and you don't necessarily die of, if that makes sense. But in other cases, it may be more aggressive, it may require treatment at a younger age. And this is what we want to really try and get the message out there, that it's important that you seek advice early. And when you seek advice, you can potentially go on to have treatment if needed. There's three main things really that put you at higher risk of prostate cancer. I've mentioned one thing. So the first thing is age. So as you get older, your risk of prostate cancer increases. So if you're 40, your risk is low. If you're 50, your risk is a bit higher. If you're 60, it's a bit higher. And then if you're 70, it's even higher. So the older you get, the higher the risk of you getting prostate cancer. And the reason behind that is because your prostate responds to testosterone. And the older you are, the more testosterone has been circulating in your blood to get to your prostate. The thing we're really going to focus on today is your ethnicity, so the color of your skin, essentially. Now, we know that if you are African or Afro-Caribbean descent, you are more at risk of prostate cancer. And not only at risk of prostate cancer, but at risk of potentially a more aggressive form that may require treatment, and even require treatment from a young age. So it's really important that for Black men, that we seek advice early and potentially save your life. Family history is something that's very important as well. We know that if you've got a brother, if you've got an uncle, if you've got a father, grandfather who's had prostate cancer, that in itself can put you more at risk of having prostate cancer. So it's important you know what your family history is, you know what's happened to the people around you, because it may well be that their prostate cancer can potentially affect your risk of prostate cancer. And interestingly, we also know there's other cancers that are related to prostate cancer as well. So if your mum's had breast cancer, if your sister's had breast cancer, if your auntie's had breast cancer, that in itself is linked to prostate cancer. So go and get yourself checked, go and have a discussion with your GP. We think that some lifestyle factors might affect all cancers. We know that if you're overweight, we know that if you smoke, that can also increase your risk of cancer. So wherever possible, obviously try and cut these things down. Now, this is something that our campaign is really looking to address. If you're a Black man, you are up to 3 times more likely to develop prostate cancer compared to a white man or an Asian man, for example, as I described earlier on. We know that 1 in 4 Black men in their lifetime will get prostate cancer. And I spoke to a group of men only last week. I think we had about 30 men in the room. And I mentioned the statistic, and we actually realized that in the room, about 5 or 6 men had prostate cancer, just out of 30 men or so. So we know that these stats are true. So on that basis, again, it's important that we get ahead of this, and the earlier we diagnose these things, the easier it is to cure these things, and also the more treatment options are available. Even if you're mixed race, we know that those Black genes can penetrate through and can still put you at risk of developing prostate cancer. So even if you're mixed race, again, this does matter for you as well. Now, you might be asking, okay, so what is the prostate? You know, what are the symptoms of prostate cancer? What does it do? So very, very basic, a bit of anatomy here. So we can see that these are the kidneys. Your main function of the kidneys is to filter the blood and make urine. That goes down these 2 tubes into the bladder. Your bladder fills up and then you wee. Now, this is the picture from the side. So this is your bladder here. So this fills up with urine. This is your water pipe that goes down towards the penis, and that's obviously where you wee. And this is the prostate just here. Now, the prostate actually, it's not very good in this picture, but it actually wraps around the tube that you wee from. And the bigger it gets, you might notice as you get a bit older, as your prostate gets a bit larger, you might notice you get some symptoms. So you may notice that the flow of your urine isn't very good. And that's because this tube is getting squeezed on. You might notice that you're getting up in the middle of the night to go for a wee all the time. And that's because your bladder's not emptying properly, because there's a bit of a blockage there. You may even notice that there's some blood in your urine if there's a problem with your bladder or your prostate. And it's really important, if you ever notice blood in your urine, go and see your doctor urgently, because we know about 20% of people who have blood in their urine will have a cancer somewhere, blood in the urine that they've seen, that is. You might ask, well, what happens when I go and see my GP? What do they do? Usually it's a discussion about your risk. And if you're a Black man over the age of 45, we know you're more at risk. Your GP may offer you a blood test, what we call a PSA test. And what this blood test does, it helps determine what your risk is of prostate cancer. If it's very, very high, it can potentially mean that you've got prostate cancer or be an indicator of prostate cancer. But sometimes, if it's normal, it can also be a bit confusing as well. So we offer a blood test, and we may well offer an examination as well, which is like an internal examination. And it may be that using a finger, the doctor may examine you and assess to see if there's any abnormality of the prostate through the back passage. Now, this isn't necessarily something that has to happen. Obviously, you have your right to refuse if you would like so. And in some cases, we can just do a blood test and go straight to a scan of the prostate if there's any other issue. So there are a number of different options. Now, I'm not going to really touch on the treatment options for prostate cancer today, because that's a whole nother talk really. But what we want to do today really is just let you know about the campaign that we're doing. The reason that we're here is because we want to know what your thoughts are, what your feelings are about prostate cancer, and if you would be happy to be contacted, for example, by your GP to consider a blood test. If we were to turn up in your area with a mobile unit, for example, and offer you a blood test or offer to speak to you about prostate cancer, is that something that you'd be happy with? And what we'd like to do is get your ideas of our campaign, and if you think this is a good idea or a bad idea, and we're going to use these ideas and use your suggestions to try and bring this campaign forward as we develop things. We've been very fortunate, and we've actually secured some funding from NHS England to roll this campaign out across Greater Manchester. And this is something that's really, really important. We know that Black men are more at risk, and we know that Black men may have more problems essentially with prostate cancer. I think it's really important that we give Black men the opportunity to present to doctors or present to us in order to ascertain if they've got a problem with their risk, and look at ways that we can treat them thereafter. So I only wanted to speak very briefly on this today, and what I want to do, and I think what's important, is to hear from Gilly, so Gilbert Morgan. So he is a prostate cancer survivor who's been through this, and he's going to tell us a little bit about his story. He's someone who's really, really passionate about this, and he's spoken on TV, spoken on radio, spoken all over the country about this. And I'm hoping that by hearing his story, hopefully you'll be enthused to go and see your GP yourself, or at least seek some advice. So Gilly, if it's okay, I'll stop sharing my screen. I'll just hand over to you if that's all right.
Yeah. Hello? Hello, can you hear me? Hello? Hello?
Yes, we can hear you.
Okay.
We can hear you, Gilly, that's fine. So what I wanted to ask you, if that's okay, is can you just tell me, so I know that you were diagnosed with prostate cancer when you were about in your late 40s, is that right?
Yeah, 49.
49. And just can you just tell us a bit about how that happened, and what was the process?
Well, quite honestly, I was very lucky because I've been going to my doctors since I was 42. Okay, I was going regular every 6 months, and after about the 8th or 9th visit, everything was fine for about 4, 5, 6 years, no problem at all. All my blood tests, all blood pressure, everything was fine. I went, I think it was the 9th time I went, and it was I think it was in March of 2013, no, September 2013. And everything was fine. I went back 6 months later of the March 2014, and my doctor said that my prostate levels had raised within 6 months of me my last test. So at first I didn't understand what it meant, but my doctor just basically said to me, there's 2 things I can do. I can do a quick internal test, or I can actually make an appointment and send you off, for some tests. So I said, well, what's the internal? So he explained it to me, and I thought, oh, I've heard about this, the actual things at your backside. So I thought, you know what, doctor, I was fortunate, I've known my doctor for quite a while. So I said, doctor, if you've asked me about this, go ahead and do it. And he did it in 2-3 seconds. That was it. But what I will say, those fingers, or that finger, saved my life. I'm here to this day. And what I realized over the years, especially Black men, a lot of Black men have this phobia of having a finger or some professional person actually putting a finger up the backside. They find it as it's like violating the body. But you know what? I've told so many men over the years that that finger saved my life, and I'm stand up proud, and I'm and there's nothing wrong with it. I don't know where this fear came from. I don't know where it came from, but I've tried to help and advise as many people from that day to this day, and I know it does work because a lot of my friends have actually gone for the test, and they've come back and said, Gilly, you know what? I've got prostate cancer, but because of you, I can sort things out. A lot of men that I do know, I've still not gone. They've still got this fear factor. Where that come from, I don't know. But as a black guy, I'm 57 now. And when I was 49, I was looking at getting to 52 and dying. But I realized through a bit of research, if you catch prostate cancer early, it's one of the easiest cancers to actually overcome. And that's why I'm here to this day. And I'm here to save lives, or just to give people advice, or just to go to the doctors. Don't be embarrassed. Don't be, macho gets you dead. You're 6 foot under. I'm not macho. I'm very humble. I'm very honoured. I'm proud to be even actually sat here giving this little, introduction about myself, so I can help people as well. Hopefully, people that's not been for the test or got a few questions that were asked. But yeah, so that's me, and I'll always do what I can to help people, encourage men to go to the doctors just to get a simple blood test, because it's not. A lot of men have this, where it came from again, finger up your backside and that side of test. And no, it's a blood test from your arm. I think they can do it from your wee now as well. So, but that's all to do with, like, obviously latest technology and things like that. But that's why I've been involved with Donna from nearly 9 years now. 9 years we've been together doing this, and I'm sure we've made a lot of good headway. And then hopefully after tonight we'll make some more.
Fantastic, thanks, Gilly. And I think that you coming out and speaking about your experiences is hugely important, and I think that also will stimulate other people to come forward as well. And I can only thank you for all the work that you've done alongside Donna and everyone else over the years. So you mentioned about the I think it's quite important, just a few things you touched on there. So obviously we were keeping an eye on your blood test. I think you decided you were going to go for the examination, and it was the examination that led you on to go and to be referred into the hospital. So can you just tell me a bit about what happened when you got referred to the hospital then? So what was your experience after that?
Well, I'm just going to be dead straight, gospel truth. I went to see three different surgeons, okay? And I'm just going to be saying it as it is, because this is all good what I'm seeing now. But the first surgeon was, the way I felt treated, as if I was a piece of cattle. I'll be dead straight with you. And I'd ask questions, but I wasn't getting the right answers, and I didn't feel comfortable and happy with the explanation of how they was going to do, i.e. the different types of operations, what they was offering me. Anyway, I seen a second surgeon, and he told me something, so I thought, no, don't like him neither. And that's the gospel truth. I'm just being dead real, because as a black man, going to see professional people, we don't see many guys like you. And that's one fact I will admit now, and that's the gospel truth. If there's more guys like you, I think a lot more guys will be at doctors, because a lot of people are put off with if a doctor says to you, oh, you're going to be okay, you don't need it now, we'll come back in 6 months. In 6 months, that person could be dead. And that's what I found with a lot of professional people, especially, I'm 57 now, and my parents grew me up to, like most parents, we grew up to, like, respect, i.e. professional people in professional jobs, and regardless of what they told us, we believed them. But a lot of it, really and truthfully, as I'm sure a lot of it didn't really pan out for me. But what I'm trying to say is, I ended up going through a personal friend who had somebody else who had prostate cancer, okay? And I was able to meet somebody who physically had the prostate cancer. My father, right, had prostate cancer, and he lied. My father lied to me because of, I don't know if it's a black thing, stigma. He was, what's the word? He was embarrassed to admit that he had this this problem where his manhood wasn't working properly at the time. So when I confronted my father and said, Dad, I've got this situation, and I believe you had it many years ago, he denied, even though my mother, my sisters, and my aunt who cared for my father when he was going through it, because I was a bit too young at the time to know. When I came of age, it happened to me, my father denied. My father denied it to me. And it broke me. I thought, Dad, I've seen your medical history. It's hereditary. My grandfather passed away. My father passed away. My uncles on my father's side, passed away, all of prostate cancer. And I was at my uncle's funeral while I was going through my prostate cancer. I was burying my uncle, if you know what I'm saying. And I'm looking at the crowd of, say, probably 200 mourners, right? And I'm thinking, 50 of them men have got the same thing. And from that time, I decided to make a change and do something about it, because I realized there wasn't enough information or advice on and about where Black men can go to get support and knowledge about how to go about getting themselves checked out.
That's brilliant, Gilly. Thank you. And you raised some really good points there. So you raised a few good issues. So the first issue, the most recent one you've just mentioned, is about the fact of family history. So as you said, so it's really, really important that if you've got a family history, that increases your risk of prostate cancer. Yeah. And you should absolutely be going and getting yourself checked out, or at least having a discussion with your doctor. You've also raised an important point as well about a lot of people are anxious about going to see their GP, or they don't necessarily trust the people they see in the hospital because there's a lack of representation there of Black men, Black women.
Exactly.
And I just wonder, just putting this out to the floor, and I'm not sure if there's any questions in the chat or not, is anyone felt reluctant to go and see their GP or their doctor because you feel that they wouldn't understand your circumstances, or they wouldn't really have the time of day for you because of this lack of representation? I'm not sure if anyone's got any comments or any questions on that at all. So we can see what comes through on the chat when we carry on with that then. So then, Gilly, and if you don't mind me asking a bit more personal then. So
yeah, sure.
You've obviously gone on to have treatment of some sort. Can you just talk us through the treatment that you had in terms of how you were during it and afterwards?
Hi. Okay. Right. Basically, when I was diagnosed, I've got prostate cancer. Because I caught it at a very early stage, I was given I think there's about 7 or 8 different choices I could have, which way I could have gone. And I chose to have it removed, okay? And I said to myself that I've got children, I've got grandkids, and I thought, well, I want to live. I want to watch my children grow. I want to watch my grandkids grow. And I thought, if I cut it out, the chances are it might never come back, okay? So I had it cut out, but I also accepted the fact that the downside of that is I might become impotent for the rest of my life as well. And that's another reason why a lot of men are frightened of going to the doctor, because even though some men, their life, unfortunately, evolves around their erection. And that's what I've learned as I've got older. Men think, if that don't work, I'm worthless. No one's gonna, you know what, mate? You're wrong. Anyway, I took the choice and I cut mine out. And for 18 months, I went through a healing process of, basically, before going to, the reason why I chose to cut mine out, I was given the diagnosis of, they only gave me 36 months of life. That's all they guaranteed me. When I was 49, when they worked it out, the level of my cancer, which was aggressive, we can only guarantee you, Mr. Morgan, 36 months of life, which meant I'd have been dead when I was 52. And I was 49. I thought, what? I'm going to be dead at 52. So obviously, I broke down like a baby. I cried I thought, oh my God, and working out 3 years from the date of the letter when I'm going to die, if you know what I mean, because that's what it came in a letter from NHS saying that we can only guarantee you 36 months of life. I cut out the prostate and I chose, if I cut it out, it won't come back. Okay. Now, also, it didn't guarantee me that I would live, but the chances are, if I cut it out, the chances are I'm going to live. Well, I'm here to this day. The erection came back. I'm a happy man, and I'm full of life, and I live my life to the max. But don't get me wrong, I will tell any man, because so many of I've lost so many friends over the last 3-4 years through prostate cancer because of their own lack of knowledge or scared to go to doctors. I'm not going to say ignorance, because a lot of it, some of it is ignorance, but a lot of people they're scared of this stigma. I've tried to break it down, but my personal life is I was given three years to live. I made a choice. The choice was to have the prostate cut out, and I'm here to this day. And I believe my reason I'm here to this day is to help spread the word to carry on saving lives.
Absolutely. Thank you, Gilly. So I think it's important there to mention then about the different options that are available for the treatment of prostate cancer. So there's 3 main options, and Gilly was speaking about them before. So the first option is, and it really depends on the sort of prostate cancer that you have. So in some cases, if you have a very low risk prostate cancer, then what we can potentially do is just keep a very close eye on it. And what we can do is we can do regular blood tests, regular scans, and we can keep an eye on things, because we know that the risks of treating the prostate cancer might be higher than the risks of just keeping an eye on it. That's one option, but that's only if you've got a very, very low grade cancer. In most cases, though, if you've got a slightly more aggressive cancer, which is often what we find in Black men, what we often would do is we do one or two things. So we do surgery, as Gilly had, to actually remove the prostate. And that's usually done as keyhole surgery. You're normally in hospital for about 24 or 48 hours. Gilly, I'm not sure how long you're in hospital for, maybe overnight or the next day.
2 days.
Yeah, next day.
2 days, yeah.
So we would often operate on your keyhole surgery and you're home the next day. Now, the reason that we do that is to remove the prostate and cure the cancer, but potentially that comes with some side effects. So as Gilly was mentioning, problems with erections, problems with your waterworks otherwise. But you have to compare the benefit to the risk. So the benefit of having the surgery is that you're cured of the cancer. The risk of not having the surgery is that you could potentially die of the cancer.
Yes.
So regardless of the side effects, you have to weigh up, what the risk is. The other option is then looking at radiotherapies. That's like high frequency X-rays or radio waves to the prostate to actually destroy some of the cancer. And that's another option as well. And that comes with different pros and cons. So there's a few different options that are available, and it all really depends on what you feel is the right option for you. And you'll have that discussion with your doctor if that was to be the case. So Gilly, many thanks for telling your story.
Yes, sure.
Can I just ask, if you had, what would your message be to people about prostate cancer and about their risk? What would you say to people that are listening tonight? There's 60 odd people here.
Well, what I tell people now, a lot of people run away from me now because they know me that much. Oh my God, it's Gilly. Quick, go doctors, because if you don't go doctors, right, it'll drag you to the doctor. Here comes Gilly Morgan. Anyway, basically, whoever's listening, if I've never spoken to you before, or if you don't know me as a man, whether you're 35 years of age, Black man, mixed race, upwards. I know you've got your figures, doctor, but I go off me personally. I was 49, and there's somebody younger than me I know who's got prostate cancer, right? But I will tell any Black guy over 40, even though doctors will say you're too young or what, I will just tell any Black person, any Black man, to go to the doctors and ask for a blood test. Like I said, it's a PSA test, okay? And what my advice is, just think of your health, because especially Black guys, they like to go to the gym, train hard, looking full of muscles and great. It's like your car. Your car's nice and shiny on the outside, like our skin's clean. But if the engine's not right, that car's not moving. And that's the same principle with your body. Your health is your wealth. I'm sorry. That's a true fact that your health is, and I learned that, there's people, yourself, doctor, there's millions, there's people got millions of pounds. But if they get cancer, they can't beat it. So your health is your wealth. You go to the doctors as a Black man and go and get a test, your PSA, prostate cancer. It kills us, but it can be also, it's the easiest one to actually truthfully like overcome.
That's brilliant. Thank you so much, Gilly. So thank you for your time.
Thank
You're
you very
absolutely right.
much.
I like a nice shiny car as well.
Well, there you go.
Right,
But
yeah,
you need a
the
shiny
engine looks
body
right.
inside as well.
You're absolutely right. The insides have got to be tip top. But Gilly, thank you so much for joining us. Thank you for telling your story. It's been a massive help, I'm sure, to many of our listeners and viewers today. So thank you. So Charles, I don't know if we have any questions in the chat. Should we just have a brief moment just to see if we've got any questions?
Yes, we have a couple of questions. And so the first one, Doc, is I keep hearing that prostate cancer disproportionately affects us as Black men, but I've not heard why that is the case, unless I missed that from the beginning of your presentation. Other than being checked regularly, are there other things we can do to avoid prostate cancer altogether?
Okay, so I'll deal with the first question then. So very, very good question. So yes, prostate cancer does disproportionately affect Black men in the order of 2 to 3 times. You're more likely to get prostate cancer. As I said before, 1 in 4 men who are Black will get prostate cancer within their lifetime. Now, why is this happening? So we know that there is some sort of genetic link. We know that there is something within the Afro-Caribbean genes that puts you more at risk of prostate cancer as a Black man. There are certain factors that do affect that are currently under investigation. We also know that many Black men don't often get the opportunity to come to their doctors or have the knowledge to present to their doctors at an early stage. And we know that in some cases, Black men will present with more aggressive disease or more aggressive cancer because it's been found a little bit later. And this is why we're doing this campaign, because we don't necessarily know why it is that we don't exactly know what the genetics are behind Black men getting this sort of prostate cancer. But what we want to do is give Black men the best possible chance by coming to see a doctor as soon as possible, getting a diagnosis early, which means that you can still have treatment and all the different treatments are available, which means it could potentially save your life. So very, very good question. The answer is it's still under investigation. We think it's to do with the genetics, but that's still being looked at as we said. So hopefully that answers your question. Charles, was there another one?
Yeah, there are a few more. So someone is asking the symptoms or signs that men should look out for.
Symptoms or signs, yeah. So I mentioned it briefly before. The biggest thing to say, and this is something that Donna me and Donna have been working on from BHA, the biggest thing to say is that most people will not have any symptoms at all of prostate cancer. So you could just be walking around absolutely fine. You're going to the gym 5 times a week, you're on your bike, you're working, you're a fit young man. You may have no symptoms whatsoever, but actually there may be a small cancer that is growing inside that you don't even know about. And this is really the message, that if you are at risk, if you're over the age of 45 as a Black man, you need to go and speak to your doctor about having a blood test or a examination or both, because you may not know about it. And most men, 80–90% of men, have no symptoms whatsoever. Other symptoms that you may get, so you may remember the picture that I showed before. Your prostate wraps around the water pipe that you wee from. If it becomes enlarged, you may notice that your flow is a little bit slower. You may notice that you're getting up more at the night time to go for a wee. You may even notice blood in the urine. And as I said, blood in the urine is a really worrying sign. And that means you need to go and see your doctor urgently. That being said, if you've got a slow urine flow, if you're getting up at nighttime all the time, it doesn't mean you've got prostate cancer for definite. You could just have an enlarged prostate that's not cancerous. But these signs and symptoms can sometimes lead to a diagnosis of prostate cancer in some cases. Some other symptoms, things like if you've had weight loss without any known cause. So let's say you're not on a diet, you're not exercising, but you're losing 1–2 stones over the course of a month or longer, then that sometimes can be a worrying sign that there's a cancer inside. So these are the sort of things to look out for, really. So problems with your waterworks, blood in the urine, blood in the sperm, these sort of things you should look out for, because they can potentially mean you've got prostate cancer. It doesn't mean it for definite, but it can be an indicator of something wrong.
Thanks, Doc. So someone is asking, do you get enlarged prostate before it develops into prostate cancer?
Another good question, yeah. So there's 2 reasons that you can get an enlarged prostate. One can just be what we call benign prostate growth. So that means non-cancerous prostate growth. And that happens to all men. So all men, as they get older, the prostate will slowly grow in size. But it doesn't necessarily have to be prostate cancer. And for most men, it's not cancer at all. It's just benign growth. But in some cases, it can be cancerous. But you can have a normal sized prostate that's not enlarged, that's still cancerous, or you could have a big prostate that is cancerous. So you can be either or, unfortunately. Having a big prostate doesn't necessarily mean it's going to be cancer. Having a small prostate doesn't necessarily mean it's not going to be cancer. So it's not really related to your prostate size, unfortunately.
Yeah, thanks, Doc, because I think T put in the chat box, about the benign, prostate. So you've dealt with that. So, right, most men find the digital rectal examination very invasive. Any idea for them?
Yeah, and this is I'm glad that this has been brought up, actually, because this is one of the reasons that people are a bit reluctant to go and see their doctor, because they think, and I remember when my dad went to see the doctor, I said, look, Dad, go, you need to go. My dad is 71, so I said, look, go. Pushed him out the door, took him to the doctor. And I saw him the next day. I said, Dad, how was it? And he was shaking his head. I said, what happened? And he said, I had a blood test, and then he stuck a finger inside. And my dad didn't like that at all. He was quite annoyed about it almost. But actually, there's a number of different ways that we can detect prostate cancer. First of all, it will be a conversation about your risk. And if you're a black man over the age of 45, we know that you're at risk. The second thing would be a blood test. And that's just a simple blood test. It's just taken from your arm or from your hand or somewhere like that. And that's to assess for your risk of prostate cancer. The internal examination, so that's a finger examination in the back passage, only takes a few seconds, but that will assess to see if your prostate feels hard or lumpy, and that can be a sign of quite advanced prostate cancer. Now, obviously, we don't need to, we can't force you to have anything done as doctors. We're only there to advise. And if you say flatly, look, I don't want to have a prostate examination, then by all means, no one can force you to have it. It will help us in terms of the diagnosis, but there are other options. If the blood test is high, it may be that you can have an MRI scan or another option. So there are other options, but I would say, please don't be too embarrassed to go and have an examination. If the examination is abnormal, it could well save your life. So I think it is very important, and it gives us a good idea as doctors to make a diagnosis.
Right. Thanks, Doc. So someone is saying, my brother was advised to increase vitamin D intake and have regular exercise, but was not offered a test. Right.
Okay. So I'd be interested to know about the details of that, really. So I'd be interested to know the age of your brother, and if he went asking about prostate cancer. I think that vitamin D, so particularly if you're on treatment for prostate cancer, your bones can sometimes become a little bit more brittle. You can get what we call osteoporosis. So vitamin D can be very good in that circumstance. One of the issues that we've faced with part of this campaign is that we are finding that men are going to see their doctors and they're being turned away at the door. For example, they're getting to the reception and saying, I want a blood test for prostate cancer, please. And they're being turned away at the door. And what we need to try and do is actually educate the GPs to accept a referral, a self-referral from a man who's at risk, from a black man who's over the age of 45, to see them, sit down with them, have a discussion with them and say, yeah, let's do some testing, because it's important and we know that there's a risk. We know that there's a little bit of a lack of education with some GP practices, and that's part of our campaign to raise awareness. So for your brother's case, if he's just been given some vitamin D and he's not had a blood test, I'd go and knock on the door again and say, actually, I'm at risk of prostate cancer. Can I have a blood test? Can I have a PSA test, please?
Thanks for that. Right, so there's another comment here. There's some research looking at the effects of slavery, and that has led to a genetic connection. Any thoughts?
So I don't know a huge amount about this, if I'm entirely honest. I know that all the research into the genetic causes of prostate cancer is still ongoing. We know there are a certain number of genes and gene lines that can cause prostate cancer, and that can also cause breast cancer. We know those very well. And we think that these are expressed higher in black men. We don't necessarily know why this is at the moment. I'm not sure, if I'm honest, about any links to the slave trade and whether or not that is linked and what the research is there. That's not something I'm familiar with. But we do know there are some genetic elements to it that are under investigation as things are at the moment.
Thanks, Doc. I'm conscious that some of our viewers joined midway. So therefore, I wondered whether the imagery about the enlarged prostate, whether you're able to bring it out and then just talk people through it as well. I mean, whilst Doc is doing that, if you have any more question or there's an experience you want to share, feel free to use the raise hand feature or put it in the chat box. Also want to know where you're joining us from this evening. So, just give us your area. We're not going to come looking for you, but it's just to help, with our data collection. So Doc is going to share his, slide.
Yeah, that's perfect. So let me just move this off. So hopefully you can see my slide. So just for those who've joined a bit late, and I think just before we go on to that, what I'd just say is we're going to just do a poll in a moment. So what we're doing is we're doing a campaign in Greater Manchester to raise awareness of prostate cancer in Black men. We know that Black men are more at risk of developing prostate cancer. Not everyone knows this in the communities. We're trying to get the message out there and really empower people to go and see their doctor, see their GP, and seek advice regarding a blood test and an examination potentially. So what we want to do is want to get your ideas on what you think about this campaign. So if you've got a smartphone, so if you've got an iPhone, what you can do is you can just, if you open up your camera, you can scan this QR code, or you can go to slido.com and just type in this code here. So I think we're going to put this code into the chat, and this will take you to our poll that we're going to do in just a moment. We'll do it in the next few minutes, and we'll just be able to do a kind of live stream of and get some answers really for what you think about certain aspects of prostate cancer. And it's really just to get what your ideas are and what your experience is of prostate cancer so far. So as I was mentioning before, we were talking about the campaign that we've been doing. We've been speaking about the things that put you at risk of prostate cancer. We know that the older you are, the higher risk of prostate cancer there is. We know that if you're a Black man, you're at risk of prostate cancer. And we know that if you've had a family history of prostate cancer or breast cancer, that puts you even more at risk of having prostate cancer yourself. We know Black men are about 3 times more likely to develop prostate cancer, and about 1 in 4 Black men will have prostate cancer in their lifetime. We were speaking about the symptoms. So just for those who weren't here before, so if you imagine this is your bladder, this is your water pipe where you wee from, and this is your prostate. You can see that if your prostate is enlarged, whether that's due to cancer or not, that can almost strangle the tube that you wee from, and it can cause a blockage. So that can cause blood in the urine. That can cause a slow flow when you go for a wee. That can make you get up at multiple times at the night time because you're not emptying your bladder properly. So these are the sort of symptoms to look out for, just to answer those questions before, just so it makes it a little bit more clear. So I think what we'll do now, Charles, unless there's any other questions, I think we'll go to the Slido, and then we can finish off the questions maybe at the end. Is that all right?
Yeah, that's fine.
So again, what I'd say is, if you've got a smartphone, you can just scan this QR code, or just go to slido.com and type in the code 2583488, and we're just going to do a quick poll just to get your ideas really of prostate cancer. Okay, so the first question for everyone then. So again, the QR code is just at the top here, so you can scan that or go to slido.com 2583488. So the first question that I've got for everyone, and again, let me be very clear. This is not a test. This is all completely relaxed. It's not a test. It's just to get everyone's ideas, and we're going to use these ideas and look at what people's knowledge is of prostate cancer to help build this campaign that we're doing at the moment. So we spoke about this briefly before, so we'll just see what people understand about this now. So if you can just answer the first question. So which of the following do you think increases your risk of prostate cancer? Okay, so we'll just leave it 30 seconds or so. And Charles, just to check, we've got till, is it till 8:45 we've got, just so we've got enough time for some questions at the end?
Yes, we do. I mean, there's a question about what types of food will be
I'll tell you what,
helpful.
Charles, should we just save the question? Should we do the poll quickly?
Yeah.
And then
Okay.
I'll come back and do questions at the end if that's okay. So we won't miss any questions, don't worry. So we said, which of the following do we think increases the risk of prostate cancer? So let's have a look at the results then. So absolutely correct. So we know that ethnicity is the biggest problem. So if you're a black man, you're at the biggest risk. Family history, biggest issue as well. Absolutely correct. Age is a big issue. Smoking, so smoking can put you at risk of many cancers, not specifically prostate cancer. And then something else, I'll be interested to see if you put in the chat, whoever put something else, I'll be interested to see what your comments were on something else. Okay, so that's very good. Let me just get that saved. Okay, good. So the next question then, which symptoms are associated with prostate cancer? So we've got difficulty passing urine, needing to get up and wee more often at night time, back pain, hip pain, pain in your pelvis, blood from the urine or the semen, weight loss, loss of appetite, feeling sick, no symptoms, or anything else. So we'll just leave it 30 seconds or so. Okay, so we can see here, yeah, so difficulty passing urine absolutely can be a problem with prostate cancer. In many cases, though, that may not be prostate cancer. It may just be enlarged prostate that isn't cancer. Needing to get up at night time, that can be one. Blood in the urine. So blood in the urine is a really worrying feature. We know that if you get blood in the urine, about 20% of people, man or woman, will have some cancer either in the kidney, in the bladder, in the prostate, or somewhere else. Obviously, women don't have a prostate, but they could have cancer elsewhere if they've got blood in the urine. If you've got pain in your bones, in your pelvis, in your hips, in your back, that can also be a suggestion of prostate cancer spread. If prostate cancer spreads, it always spreads to your bones, so that can sometimes cause issues. I've noticed that only 30% of people have said no symptoms, but actually, as I mentioned before, most people with prostate cancer won't have any symptoms at all. So I think it's important to try and remember that actually most people won't get symptoms. And then again, yeah, so headaches, feeling sick, very, very non-specific symptoms that are not necessarily related just to prostate cancer. Okay, so these questions now, getting into these questions are really important actually now for our campaign. So what do you think happens so after this webinar, let's say that tomorrow morning you call your GP and you ask your GP for a consultation. What do you think happens if you contact your GP to discuss a worry about prostate cancer? Do you think that they just have a chat with you, a blood test, feeling of the stomach, rectal examination or internal, or anything else? So I'll just leave 30 seconds to discuss that. Okay, so we can see that, yeah, most people are saying that there'll be some sort of discussion. There probably will be a blood test offered to you. You will have a rectal examination offered to you as well. And again, I'd be interested in the chat for those of you to see what something else would be as well. So if you put something else, just say what that thing you might be in the chat. Okay, so that's really useful. And you can put this into the chat or you can write this here. Is there anything that would worry you about contacting your GP about prostate cancer? Is there a reason that you wouldn't? Is there a reason that you'd be a bit worried about it, or that you might leave it? So we've got 9 people typing, so I'll let you all type away. Okay, so fear. Okay, so that's a really interesting one. So again, in the chat, I'd be interested to see, is that just fear of how they would react to you, or is that fear of potentially having a cancer? We've got some interesting comments here then. So someone said not at all, so there's nothing that would worry them. someone being turned away. I think this is a really important point, and this is really important as part of our campaign. What we're absolutely clear on is we don't want people being turned away by their GPs if they are at risk of prostate cancer. So we need to educate the GPs, we need to give the GPs the resources, and with our funding now, we should be able to do this to educate GPs not to be turning people away at the door. And some people have had several tests being misunderstood. Again, this is about educating the GPs. Okay. Okay, so have to so again, I'll be interested to hear what these thoughts are about. They've got to respect GDPR. So obviously all GPs, all medical professionals have to maintain absolute confidentiality with patients. So I'll be interested to see what your thoughts are in the chat a bit later on that. And again, other people saying that they're worried that the GP wouldn't take them seriously. So all very similar things that are coming up really, and similar themes. And I'm hoping that through our campaign, we can help GPs listen to your concerns and make sure that GPs are taking people seriously. And if GPs aren't doing that, then we can look at other resources where we can come to your area. So for example, in Manchester, whether that's with a mobile van, and we can offer you a PSA test that's done by ourselves as part of our campaign. Okay. Okay, I think we've just got one more question after this. So if there was a mobile van in your area, so if there was let's say a van or a coach, and it had, for example, myself as a urology consultant, one of my colleagues, some nurses, and some other members of our team, if this turned up to your area, let's say this turned up to your church, let's say this turned up to your local supermarket, and we're pitched up in the car park, and I said, okay, hello, sir, would you like to have a blood test, or would you like to have a discussion about prostate cancer? Do you think you would come along? Would you book an appointment with us? So that's a yes or no. Would you want more information, or are you not sure? This is probably the most important question of our campaign, really. So I'll just leave it 30 seconds or so. Okay, so it's interesting to see that most people are saying yes, which is reassuring. Some people want a little bit more information. Some people might be in a rush if they're doing their shopping or late coming out of church. They might want to just go home. So it depends on the time of day. Okay, that's really useful. Okay, and then the final question: is there anything else that you would find helpful to understand prostate cancer and your risk of developing prostate cancer? So do you want some leaflets or some resources on a website to have a look at? Is it useful to have a presentation from a professional, someone like myself who deals with prostate cancer? Do you want to hear from people like Gilly again, who have had prostate cancer, who can tell you their story, which I think is really, really important and gives you a really good insight? Or do you want to have events at your community? And then finally, do you want to just hear from your GP about information of this sort? Okay, so a lot of people wanted to hear from professionals. Other people, yeah, so it's almost neck and neck there, isn't it, about hearing from other people who've got prostate cancer. And some people want to look at stuff in their own time as well. Okay, fantastic. So thank you very much for that. We're going to take this information away now. And what we're going to do with this information is, as I said, we've been working with CAHN, we've been working with BHA, with Donna and Lesmond and a few others who've been really instrumental in getting this campaign up and running. And we're going to look at how we can organize this campaign and look at the information that you provided on how we can shape this in terms of what you would like us to do. Because we can sit in an office and we can make whatever campaign we want to, but it's really important that it lands right with the people that matter and the people that we're trying to target. So that's really, really important. Okay. So I suppose now we can just go to see if there's any questions from anyone. So I'll stop sharing my screen.
Yeah.
And we've got about 15 minutes left for for questions. But thanks very much everyone for doing those that Slido. That's really, really useful for us.
Yeah, thanks, Doc. For all those who joined in late, then there's an opportunity to watch this because it's been live streamed to YouTube and Facebook as well. So the link will be posted in there. Doc, someone wants to know how to deal with enlarged prostate and whether there are foods to avoid and foods to eat.
Okay, so if you've got an enlarged prostate and you've gone to your doctor and you've had a blood test, a PSA test, and they've examined you and they're happy that it's not cancer, then things to avoid. My favorite things: caffeine, fizzy drinks, and alcohol. If you have those, all they can do is they can cause stimulation and irritate your bladder. So we say avoid those things because that'll mean you're going up and getting up to go to the toilet more often at night time, and you may find that it can affect your flow as well. So they're the three things to avoid because they can impact your bladder. You can try having decaf tea, decaf coffee. It tastes exactly the same. And then try and avoid the fizzy drinks and alcohol if possible, or at least cut it down. I'd say avoid caffeine in the evening as well because that can irritate your bladder, obviously, as you go to bed at night time. There are some simple medications that we can try as well. There's a medication called tamsulosin that your GP can prescribe that helps relax around the prostate and helps the flow of water be a little bit better as well. So there's some simple things you can try.
Yeah, thanks for that, Doc. Does the kind of a bike seat or cycling, does it contribute in any way to prostate conditions?
Very good question. So we used to think that if you used to go on long bike rides, that can cause problems with your prostate and also cause problems with this blood test, this PSA test. But recent studies have suggested that's probably not the case. So it can sometimes cause some discomfort in that area, what we call the perineum, but it shouldn't cause prostate problems, going on long bike rides and things like that. So the answer to that is no, it shouldn't really cause issues.
Thanks, Doc. Another question: can cancer cause back pain?
Yes and no. So the most common cause of back pain is arthritis, muscle strain. It's usually what we call a musculoskeletal problem. So that means a problem with the skeleton or a problem with the muscle. So you strained your back, you've slipped a disc, you've got some arthritis. That's the most common cause. But if you've got pain that is consistent, that doesn't get any better, that actually is getting continually worse over weeks and months, then I'd go and see your doctor. In some cases, if you're if you're over the age of 50, they may again do this blood test just to make sure that you've not got prostate cancer that is spread. Because if prostate cancer spreads, it spreads to your bones most commonly, almost all the time. So if you've got persistent back pain, again, go and see your GP. They may do a blood test. If the blood test is normal, you can be reassured that it's not prostate cancer that is spread usually.
All right, thanks, Doc. Someone wants to know what's the campaign you talked about earlier on, the campaign you're running. What are you hoping to achieve and whether it could possibly change attitudes to help men who are hesitant?
Yeah, so we're hoping to achieve two things. First of all, there's several things actually. The first of all, what we're hoping to achieve is we want more Black men seeking advice, seeking medical support at an early stage to find out what their risk of prostate cancer is. If they do that, then they could potentially save their lives and have prostate cancer that is treated. That's the first thing we're trying to achieve. The second thing we're trying to achieve is to educate GPs and to empower people to be able to go to see their doctor and actually have a discussion about this. Because at the moment, as many of you said, people are being turned away at the, they get to the front door of their GP, they're getting turned away. There's no time, etc., etc. But actually, we want to empower people. It's your right to go and have a blood test. If you're at risk, that's what the NHS is for. So they're the two things we want to do. We want to get people knocking on the door of their GP, knocking on the door of organisations like ourselves to ask about prostate cancer and reduce risk and hopefully save lives.
Okay, Doc. So a follow-on to that, someone is asking, what advice would you give as a take-home message if someone feels their GP is reluctant to give them a PSA or similar test? What would your advice be?
My advice would be, if you go to your GP and the receptionist says, no, you can't have an appointment, my advice would be that you want to speak with the doctor or at least the practice nurse. So you need to be given an appointment. you are a person who is at risk of developing prostate cancer, particularly as a Black person, or if you're a person with a family history, and therefore you want to have a blood test to exclude that. That would be my advice, and I would be persistent with this as well. Our campaign at the moment is looking at educating these GPs, but it does require a little bit of persistence. Some of the people that we've seen recently who've had prostate cancer said, you know, they went back to see their GP 2 or 3 times to say, look, give me a test. Look me in the eye and tell me that I've not got prostate cancer. No, you can't do that. So on that basis, I want to have a test.
Thanks for that, Doc. Really helpful. How often should one get tested?
Yeah, so it's a good question. So I think if you've had a normal test previously, it depends on your age, really. If you're someone who's quite young, let's say you're in your 40s or so, and you've had a normal test, I'd advise getting your blood test again in the next 2 to 3 years. If you're someone who's a little bit older, maybe 50s or 60s, and your blood test has been normal but a little, you know, on the borderline, I'd look at maybe getting a test done once a year or so.
Okay, Doc. Thanks for that. Just checking. So some really positive feedbacks about the session tonight. Extremely well structured, informative presentation. Thank you. And then thanks. Lots of that. So, well, you talked about food earlier on. I think someone is encouraging leafy greens and pumpkin seeds. And
leafy greens are always good. Well, you know,
yeah.
High in fiber, always otherwise good.
Okay.
But the main things that we know about for definite are your caffeine, your alcohol, and your carbonated drinks that can affect your bladder.
Great. I think we have someone by name T with their hand lifted up. Well, so can you unmute and ask your question? Thank you.
Unmute. Hello, can you hear me?
Yes, sir.
Yes, we can indeed.
Okay. Good evening, everyone. My name is Tony. I'm from London, and I just want to, say thank you to Gil, because similarly, I went through a similar experience just over a year ago, where I had prostate cancer, and I went through the operation also. So the way I found out about mine is that, yes, I used to wake up at night and do regular urines, and also the stream was slow. So I went to the doctor for something else, and because as a Black man, you don't regularly go to the doctor, so there was a locum in and said, I haven't had a full blood test for a number of years. So she did a full blood test. I went there. She said my PSA was high. And then she referred me. I went to a sort of private hospital after that. And yes, I had the finger up the bum, and it was an enlarged prostate, but then I had to go for a biopsy. So the biopsy showed that there was cancerous cells, but they were very minimal. So as you say, you have the 3 options. One, you can, there are tablets you can have, and then the other one was radiotherapy, and then the other one was surgery. I opted at that time for just to monitor, because there were, the cells were small, and I didn't know whether it was aggressive, whether it would grow. Moving on from that, a year later, I had another biopsy, and they showed that the cancer had spread. After that, I suppose I had, COVID kicked in. So then there was lockdown, but they put me on a short waiting list, and within, I suppose, 3 months, they gave me an appointment and I had the operation. My only concerns there are that men need to know what the after effects would be. I didn't know the after effects of coming out of surgery and the lack of continence, and that will take time to well, some people have urine continence straight away and others don't. You know, it grows back over time, over a number of months. So the ideal thing that I think people, men need to know when they're going through, one, that although the PSA gives you an indication, you may also need to have a biopsy. Just because you have an enlarged prostate does not mean that you have cancer. And so therefore tablets can sort of, there are people that take tablets and it reduces the size and they have a perfectly happy life. It's for, I suppose, a few that may have to go through the surgery. And as was said initially, that it is not a death sentence. Just because you have it doesn't mean that you're going to die. And I can say that because when my wife and my children heard, oh, daddy's got cancer, they freaked out. I was very calm because, you know, life would go on. And once they found out the information and the likelihood of the survival, everybody was calmer. And then we just went through the process. And as I say, at the moment, I'm due to go for another PSA blood test. My levels are under 1. So after you've had the removal of the prostate, they're looking for a PSA of minus something. And life is good. So men, you need to go and get your PSA checked, definitely. And if you have any symptoms of slow urine flow or getting up through the night and urinating a lot, that is an indication, but it isn't a guarantee. That's all I have to say, gentlemen. And
That's
ladies.
fantastic too. Thank you.
Yeah.
Thank you very much for sharing your story. I think you've touched on quite a few important points there, haven't you? So, first of all, you may or may not have symptoms. It looks as though you have the symptoms of enlarged prostate, you know, the slow flow and everything else. But again, that doesn't necessarily mean that you've got prostate cancer. We didn't really touch on the idea of having a biopsy, but the biopsy is the only way that we can actually diagnose prostate cancer, certainly. So if you were to have an abnormal blood test, you would go on to have an MRI scan, and then afterwards you would have a prostate biopsy. And then at that point, if you were given prostate cancer, as you said, you'd be offered one of the three options: keep an eye on it, surgery, or radiotherapy. But yeah, it's very useful to hear your story. And as you say, the overall message is positive. Our cure rates for this sort of thing are extremely high, provided we catch them early. So thank you for that.
Yeah, thanks once again, Tony. So I've got 2 hands raised. We'll take that quickly and then we can try and pull things together. But I think, Doc, earlier on, you mentioned the medication that helps. So someone would want, you know, in your wrapping, you know, as you wrap up to mention that. And once again, if you join late, not to worry, this has been live streamed. It's available on YouTube. The link is in the chat box. So I'm going to take Leroy and then Silas, and then quickly I'll get Doc to sum up. So Leroy, feel free to unmute.
Okay. Can you hear me?
Yes, we can hear you now.
Thanks for that now, yeah. Very quickly, mine's at the initial stage. I'd seen adverts on TV encouraging men to go and get tested. I went to my GP and he said it's well and good the government promoting this, but they're not giving the money to GPs for screening. So I said to him, well, that's not my issue, doctor. I've come for the test. So all I will say is I had to have a very robust discussion with my GP. In the end, he said, okay, I'll send you for a blood test. Now, I think your PSA level should be about 4, around that area, 4 or 5. He rung me within a few days to tell me that my PSA level was 14.5. So I've had the biopsies, and I'm just waiting now for the next stage for treatment. So all I would say is you need to have a very robust discussion with GPs if they're refusing you to have the blood test.
That's great, Leroy. Thank you.
Thanks for that, Leroy.
Where are you from, Leroy?
Bury, but Manchester, Greater Manchester.
Manchester. Are you one of our people? Okay, Manchester,
yeah,
right.
Yeah, Les's brother.
So
Okay.
I think that you've raised a hugely important point there. In some ways, as things currently stand, as sad as it is, you need to be a bit forceful to get this blood test, because this is your life, and at the end of the day, the GPs can talk about funding all they want. As you say, Leroy, that's not your problem. Now, as part of our project, we've secured a lot of funding, actually. Best part of £1 million to roll this project out. And as part of that, that's what we're looking at, getting the GPs involved. But as you say, you're fighting for your life here. Go and get your test, and you have to be a bit forceful about it at the moment. Hopefully that will change. But thanks for raising that.
Right. So we'll take Silas, and then we'll come back to you, Doc, for wrapping up. And then also we've had various people within our community who contract that quite early, before 50s, sometimes late 30s, early 40s. So it'll be good for you to touch on that as well. But Silas, could you unmute and then make your contribution?
Hello, everyone. Can you hear me?
Yes, we can indeed.
Hello. Thank you for bringing me up to the platform. Thank you, everyone, for the enlightening information that has been shared on this platform. My question is based on surveillance. I wanted to know, how is it decided whether somebody can have surveillance, say that for 12 months or 6 months? What is it based on?
Yeah, good question. So we offer survey. There's three. We grade prostate cancer in one of three ways. It's either low risk, intermediate risk, or high risk, and that's kind of self-explanatory, really. And we look at your MRI scan, we look at your blood test, this PSA result we were talking about before, and we look at your biopsy result, and that's how we categorize your risk. Now, if you are low risk, we know that your chance of dying of this sort of prostate cancer is extremely low. And you may hear people say the phrase, oh, prostate cancer is a disease that you die with rather than die of. And that's not necessarily the case for all sorts of prostate cancer, but if you've got a low risk prostate cancer, then actually you're much more likely to have a stroke, be run over by a bus, have a heart attack, or something else is much more likely to kill you than that sort of cancer. So we know that actually we can avoid surgery and we can avoid radiotherapy, which does come with some side effects, because we know this particular type of cancer isn't aggressive and we can safely keep an eye on it. In some cases, we'll keep an eye on it for many, many years. We'll do a regular blood test once every 3 to 6 months. We may do a repeat MRI scan to have a look at the prostate again. We may even need to do a repeat biopsy at some stage. And if there's any suggestion or any sign that the blood test goes up, the MRI scan looks a bit more different, or the biopsy looks a bit more aggressive, then we offer you treatment at that stage. So we're trying to avoid the need for treatment, which does come with side effects, because we know that you can potentially outlive this cancer, if that makes sense.
Thank you. Can I ask you a follow-on question, if I may?
Yeah, please.
Myself, I've been offered a HALOP procedure. And would you just briefly explain what it is and what are the benefits?
Yes, a HOLAP procedure, that's a procedure that we use to treat an enlarged prostate that is benign, so non-cancerous. And we normally use that for prostates that are quite large, normally over about 100 grams or so. And it's actually a laser, so it's done under an anesthetic, so you put to sleep. And we actually use a laser to remove the inside of the prostate to allow you to wee properly. So if I'll very quickly, because I know that we're running out of time, if I just show you on my screen here. So you can see your prostate here. You're under anesthetic, so you're asleep. The camera goes down the water pipe, and we use a laser to actually remove the prostate from the inside. And we essentially shred it up into very small pieces and suck it all away. So this opens the channel again, so you can wee a little bit better. But that in itself isn't a treatment for prostate cancer. That's just a treatment for enlarged prostate and symptoms thereof.
Right. So, I mean, because with me, I've had a biopsy and they've said one of it is positive. So I was thinking if I had that procedure, they're going to get rid of whatever has been seen. Is that possible or it's not possible?
It is possible. They may well get rid of it, but it's not the formal treatment for prostate cancer, because there will still be some prostate left inside. But they probably will, if it's only very low risk, they probably will get rid of almost all of it, I would have thought.
Right. Okay. Thank you. Thank you very much for your explanation.
No problem. So
brilliant. So, Doc, over to you for wrapping up.
Yeah, well, I mean, I think we're 3 minutes over, so sorry for keeping everyone over time. But first of all, guys from CAHN, Charles, the rest of the team, thank you so much for putting this event on. I'm hoping that all the people watching, I think we've got 64 people. Hopefully, you all found it useful. If there's anyone who's going to be watching at home later on YouTube or otherwise, hopefully you find this useful as well. Take home messages. If you're a black man over the age of 45, go and knock on your GP's door about getting a blood test and a discussion about prostate cancer. And thanks for having me.
Thanks a lot, Doc, for taking time to share that. Thanks to Gilly, to Leroy, and Mr. Taylor as well for sharing your stories. And just so that you all know, usually these sessions are on Saturday morning. So coming Saturday, we'll be looking at cervical cancer and why it's important to take up screening. And once again, it's all about prevention, but then also making sure we're looking after ourselves. So thank you, everyone. It's available on YouTube. You can have a listen to again. And if you have any questions or you want to touch base with Doctor, just email us health@cahn.org.uk. Once again, massive thanks to all the CATHIP partners, so Croydon BME Forum, Enfield Caribbean Association, Rafa International Development Agency in Birmingham, Black Health Initiative in Leeds, and RCCG Royal House in Sheffield and CAHN. Enjoy the rest of the evening. And for those who may not know, next Saturday, there's a gala in Manchester. I think this Saturday, there's another one in Leeds that Black Health Initiative is organizing. So lots of celebration. We're still in Black History Month. And yes, we want to make sure we celebrate all year round. But October is the springboard for us. So please grab a ticket, go along, look out for other Black History Month events. And let's celebrate the contributions we've made here and overseas. Thank you and have a lovely evening.
Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CAHN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating, and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members, and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses, and faith leaders. Our health hours cover a range topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell, and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@CAHN.org.uk. We encourage you to invite others to our health hour session. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.